Hey everyone, welcome to another episode of Bad Blind Moms.
We're just two blind moms doing our best and getting it all wrong.
Yeah, that's for sure. I am Bridgit Kenning-Polpeter, coming from Urbandale, Iowa.
And I am Stacy Cervenka, coming from Lincoln, Nebraska. And today we have a badass blind mom with us, Ronit Ovadia. Do you want to introduce yourself and where you're from?
Sure. My name is Ronit Mazzoni. And
Sorry, your maiden name. See, we're already bad. We're already making all the mistakes. Okay.
That's okay. I'm married now. My name is Ronit Mazzoni, and I am from California. I live in Northern California with my sighted husband and my 3 sighted children, ages 9, 6, and 20 months. And I work I'm a genetic counselor. I currently work at a county hospital in the area. And for those of you who may not know, genetic counselors are healthcare professionals who help families understand the risks that may come along with family history of inherited disorders, or understanding abnormal test results, as well as helping to diagnose a child that might not be developing as we expect. So I see a variety of patients, some of whom are pregnant and others who are children and others who are adults. And we try to educate them and help them advocate for themselves in learning about their health.
Excellent. And, I was just thinking as you said that, the funny thing is, like, I was actually at your wedding. So you would think that I would know that you're last. And it's not even like you got married yesterday. What's it been like? 12 years.
Long time.
Yes. So anyway, so tonight we are going to talk a little bit about hereditary eye conditions and some of the concerns that blind people with hereditary eye conditions might have, or some questions that they might have, or some considerations they might have when they're deciding whether to become parents. And, disclosure, I don't personally have a hereditary eye condition. So this is somewhat of a new topic for me. Bridgit?
Yeah, I mean, I also do not, but Ross does. So he has RP, retinitis pigmentosus.
Excellent. So, but there are many blind moms that we know who do have eye conditions that were hereditary, such as, aniridia or RP. And often, people with those conditions do choose to have children. And often there are several generations of people with the same eye condition. I have a friend who, her mom is blind due to aniridia. She's blind due to aniridia. One of her children is blind due to aniridia. And, obviously, they really think nothing of it. So Ronit, can you tell us a little bit about what eye conditions are hereditary? And are there any other health concerns or disabilities that sometimes go along with these?
So this is definitely, so this is definitely not, there's many eye conditions that are hereditary. And, I want to just make the distinction between hereditary and genetic. People use those terms interchangeably, but actually hereditary means that it's being passed down in a family in some manner. Genetic means that there is a change in the genes that causes the blindness, but it might not have been inherited from a parent. So those are two different things. But some of the hereditary conditions are, as Stacy, as you already mentioned, and Bridgit, retinitis pigmentosa is one of them. This is a very complicated one in the sense that it's inherited in many different ways. It can be inherited in a recessive manner, meaning that both parents have to be carriers in order for a child to have it. Sometimes it's also inherited in a dominant way, meaning that it goes from generation to generation, and 50% chance with every pregnancy or a child. And there's other ones that are actually inherited in an X-linked manner, which is very much more complicated. Females are carriers and males are affected. So it's often hard to determine how it's being inherited or what the actual mutation is in a family, because there's so many genes involved. So RP is complicated. retinoblastoma is another one. And with that one, there is this risk of cancer that can cause, blindness, cancer of the eye. And it can be in one eye, unilateral, or in both eyes, bilateral. It's often a lot more hereditary when it's in both eyes. But that would be an example of one where there'd be something else going on in addition to the blindness. And then sometimes there's other conditions that occur that come along with other disabilities, intellectual disabilities sometimes, other organ systems are involved, but there's just a lot of them. It really depends on what it is.
I think that's really, in the blind community, you do find a lot of parents who have hereditary or genetic eye conditions who think nothing of it and choose to have kids. And, as I said earlier, they might be a third or fourth generation with this particular eye condition, and the family just considers it, part of their family's normal life. And then you also have people who are blind due to, let's say, retinoblastoma, and they may have concerns that, hey, I'm not only passing along possible blindness, but I'm also possibly passing along cancer. And as we know, people make different decisions. I know people with retinoblastoma who have chosen to have kids, saying, I made it through, and I'm not concerned about giving it, or not concerned, but it doesn't dissuade me from having children. And then I know some other people with retinoblastoma who have said, look, it's not the blindness, it's cancer, and I don't want my kid to go through the cancer that I did. So
it's really interesting too that that there's the distinction between hereditary and genetic, because I actually did not know that. So I really appreciate that information. Like with my husband having RP, he and his older brother are the only two people in their family that have ever had it, that they're aware of. So yeah, RP definitely is very a complicated one. And, I know several people with RP who, some people do have a very long family history of it. So, but yeah, that was very interesting. And I really appreciate that information because I did not know that.
And, I think a lot about, I know a lot of families that have several siblings with Leber's congenital amaurosis. It seems like often when there's, a number of siblings in a family, and maybe there are also blind parents, it often seems to be Leber's or RP.
Right. Yep.
Yeah.
Those seem to be the common ones.
So if you do have a hereditary or genetic eye condition, what might be some of the concerns that people might think about in becoming a parent? Is there anything that they might want to consider when they're, kind of making that decision?
So, I think the biggest thing to consider is, do you want to become a parent? Right? Like it's I say it that way just because, this is not specific to these people who have a hereditary condition, but to anyone who wants to become a parent. If you are a blind person and you want to become a parent, do you want to become a parent? Yes. Great. Then you should do that. I think that if you have a hereditary condition, you might want to learn about what are the risks of passing it down, not because you don't want to have a child with that disorder, but just so that you are more prepared. Some people like to be prepared. Other people maybe don't want to be prepared, and they just say, if it happens, it happens. And that's also fine too. But if you are curious about the risks, you could certainly go and talk to a genetic counselor to determine if there is a way to get a better sense of the risk, depending on what it is that you have, and whether we can identify what's causing it. So as we mentioned, it's kind of complicated, but if you are curious, you can certainly get asked to get referred to a genetic counselor that can help you talk through those risks. And again, not because you maybe don't want to have a child with it, but so that you just are aware. And I think the only other thing is, is again, not specific to this, but just to blind parents in general, or, blind people in general who want to be parents, be as confident as you can around other people, and, sort of in your own mind and your own sense and with your own blindness skills, so that when you do become a parent, you kind of have to fake it till you make it, and parenting is no different. So, yeah.
So now let's say that a parent has a hereditary eye condition, and they, would like to know more information about the chance that they might pass it along to a child. What are the steps that such a person should take?
So I think if they're interested in learning more about that, they can ask their OB or even their primary care doctor for a referral to a genetic center where they could see a genetic counselor. This could be either done before getting pregnant, so as a preconception type of meeting, or during a pregnancy. Oftentimes during a pregnancy, people will assume that you want to have this type of meeting because you want to do testing on the fetus. That's not necessarily, what you might want to do, but people might assume that. So you may have to correct people if you're just interested in sort of getting to know what the risks are. If you do it prior to getting pregnant, then, it's a little, people might understand a little bit better that you're trying to understand the risks. But then of course you're not pregnant yet. So yeah, so things come along in sort of different ways depending on when you do it.
So for most people, talking to their either their primary care provider or their OBGYN would be the first step in being referred to a genetic counselor.
Yeah, usually the OBs or the primary care doctors don't know enough to answer these questions. Sure. So it would be it's always a better idea to get referred to see genetics.
When I was pregnant with our oldest, our OBGYN team actually were like, hey, do you want genetic testing? Because Ross has RP. And so we didn't even have to seek it out. I don't know how common that is, but we at the time, obviously we're aware that Ross has it, his brother has it. I believe that his family has gone through some, I don't know if it's genetic testing or I think they've been able to kind of figure out what, type of RP it might be. But I don't know, we personally didn't have a lot of concerns. Our kind of thought was, well, it doesn't seem likely that we would, pass this along. But even if we did, we just felt confident enough in ourselves and the people around us that, we knew how to, deal with that. And, it's not like there's a treatment for RP. So, for us, it just didn't seem that necessary at that point in time. But yeah, I do remember that we were actually asked if we wanted to do that because which by the way, we had a fantastic, I had a high risk pregnancy. So we had a fleet of OBGYNs, but they were amazing. But yeah,
you had a menu of OBGYNs.
Yes, we really did. I had 4 that I was working with. So, but they were all great. And they were all very receptive to, learning from us, but they were in the beginning, much more concerned about that than we were.
Yeah, that's usually how it goes.
Yeah.
And so do you think, this is, Ronit, as a genetic counselor, I guess, do you feel like being blind has any impact on how you talk to moms or how you talk to parents about, the incidence of disability that their child might have?
Yeah, actually, it's interesting that you asked that because this is something that I've been talking a lot about as I went through my training, and then as I have worked in sort of different places throughout my career. There's actually a genetic counselors with disabilities group that just formed. I've been a genetic counselor for over 10 years now, and there's a group that's forming now, and we're all talking about this very thing. So yeah, I think that I use my blindness. I don't, I don't always talk about it in this context, but I think the message comes across, and it depends on who I'm talking to. It depends on the patients I'm talking to. It doesn't often come up in a prenatal session where I'm talking to a pregnant patient, but I have been told by many patients on their own, without me bringing it up, that they appreciate seeing a genetic counselor with a disability because it helps them see that disabilities in general are not as much to be feared, not as feared as other people, kind of make them out to be. I find that it's really helpful in my sessions with children and their families, kids with disabilities and their families. I really am able to help them advocate for themselves. I'm able to help teach them how to advocate for their children in the school system and in the medical system, and making sure are they getting everything they need? Are they getting all their therapies? Are they signed up for this? Are they signed up for that? And, just to make sure that they're getting everything that they should be getting so they can reach their fullest potential. And so I think that those parents too find it, I think that's what I've been told. Parents find it helpful to see an adult with a disability, even if it's not the same disability, even if it's a totally different disability. I think it's helpful, for them.
I mean, I can certainly imagine a parent, saying, oh, we have an incidence of some disability or other in our family, we'd like to find out more. And then, they meet with you and they're like, oh,
like maybe not, like, oh, well, clearly you're able to do this and you have a job. And so,
right.
Okay.
So if somebody does decide to seek out a genetic counselor, what can they expect?
So typically there is some information gathering at the beginning of the session. In this situation, they would take they would ask you about your medical history and take a family history. And if you have any records that would be helpful, or if you know specifically about your eye condition, then certainly they would want to know that. And so once they get the family history or sort of all that information gathering, they usually will talk to you about what the risks are based on what they currently know. And depending on what the situation is, they may be able to give you some strong numbers. They might have to give you, they might have to say, it ranges from this to this, or they might say, this is, without doing genetic testing, we don't actually know what the recurrence risk would be. And it would be potentially as high as, 50%, for example. Or they would just say, we don't know. And so they might offer you genetic testing to try to figure out if we can identify the gene mutation that's causing the eye condition. Sometimes this is paid for by insurance. Other times it's not. So that is part of the process of figuring out about insurance. And then if you decide to do that, which you don't have to do, but that is an option for you. So if you decide that you want to do genetic testing, you might get a clear result, meaning you might get a result that is, kind of black and white. It's positive, it's negative, it's normal, it's quote, abnormal, meaning we found the genetic mutation. It also might come back showing a change in a gene that we don't understand. And that's very common these days, especially when we are testing lots of genes at once. So it might come back with something like that. And in which case that would not be very helpful in determining sort of the risk to family members. So, it can be a long process, 2 sessions maybe, or 3, depending on kind of how it goes and depending on whether you do genetic testing or not. Even if you don't do genetic testing, they can still kind of give you their best guess as to the risk if you're just curious about that. And if you go there while you're pregnant, and there's time, they might offer you testing for the fetus, depending on what is the situation for yourself. If we can test the fetus, we would have to know what's going on in you or in the family before we test a fetus. We can't just test a fetus without knowing what we're testing for.
So one thing that I often hear from blind parents is that whether they have hereditary eye conditions or not, is that they're concerned that their doctors or other healthcare providers might discourage them from having kids simply because of their eye condition, because of their blindness or low vision. And, that's a concern that a lot of people have. What do you think, in fact, I've often seen studies that show that healthcare providers actually have, among groups of healthcare providers, they actually have some of the highest stigmas against people with disabilities, and healthcare providers often have the highest misconceptions about the quality of life that people with disabilities experience. And I think part of that is because medical professionals want to heal and they want to cure, and that's their goal. And when they can't heal or they can't cure, they think of it as a failure on their part, like, oh, I couldn't cure that person. And so often then they, make kind of assume that people with those conditions have really low qualities of life. And so a lot of people do experience stigma and ableism from their healthcare professionals. So what would you recommend somebody do if their doctor, whether it's their primary care provider, their OBGYN, or someone else they're meeting with, openly discourages them or makes ableist comments about them, maybe not that they shouldn't have kids?
Well, first of all, I'd say find a healthcare provider that you feel comfortable with, and if you're with a healthcare provider that does that to you, find another healthcare provider, because there are good ones out there. They might not know what life is like for a disabled person, but a good healthcare provider will not discourage you from having children. They might ask questions, and I feel like that is okay. Even if the questions come across as offensive, I think it's important for us to educate as much as we can. And so if they say, well, how are you going to do this or that as a blind parent? Then you have to say, well, I might not know how to do it because I've never taken care of a baby before, but I have a network of people I can contact that can answer, that can help me along the way. And so making sure that if they understand that you have a support system, whether it be, your family or other blind people or other friends that you have, I think that is what's going to put them at ease. But again, I think if someone is openly doing that, find a new healthcare provider.
Excellent.
Well, yeah, because I would say that when and this isn't going to be like completely about, a genetic condition or anything, but I'm type 1 diabetic. And so obviously that's a big concern if you want to be pregnant and, you're going to be considered a high-risk pregnancy. And my endocrinologist at the time, who I loved, I had worked with for years, and he actually put me on an insulin pump when I started becoming blind. He's like, let's put you on an insulin pump. And for anybody who doesn't know, there's no accessible insulin pumps. Those of us who are blind diabetics who use one have found workarounds, but there's none that are actually accessible. And at the time, I just thought, oh, okay, that's normal. And I've since found out that it's very unusual for an endocrinologist to recommend a blind person go on an insulin pump. But so, he always had this really great attitude about it. And then the minute I said I wanted to become pregnant, he's like, ooh, I don't know about that. And I was like, okay, well, I'm going to get a second opinion.
Yeah.
And so I asked for a referral to see an OBGYN. And it just so happened that the one with had previously worked with a blind patient who, became a mom. And so he was like, oh yeah, if this is what you want to do, the blindness isn't the issue. It's just the diabetes that we have to be concerned about. So I've been very fortunate with, whether it was pregnancy or anything else, just kind of having some pretty great medical people who maybe didn't always get it immediately, but like I said, have been very receptive and were willing to actually learn from me. Because I think sometimes too, maybe unbeknownst to them, but doctors can sometimes, well, I'm a doctor. I know things,
Yes.
I know what I'm talking about. And it's like, okay, yeah, but you're not disabled. I know
right.
that. But so, yeah, I think that just finding healthcare professionals that you are comfortable with and who, yeah, might not immediately understand how a blind person is going to do things, but is still open and willing to, work with you. I think that you just have to kind of find that person or that team who, is going to kind of help you on that journey.
And also, as we've mentioned, doctors are known, and it's been shown. I know that there's been Harris polls that have shown that doctors tend to have extremely negative opinions on the quality of life that people with disabilities experience. Like the gap between the quality of life that people with disabilities say they have and the quality of life that doctors think that they have is actually larger than almost any other group. So, I mean, it's unlike, again, like I don't generally feel like it's my duty to educate every Tom, Dick, and Harry that I run into, but with a doctor, I kind of have to do that. And that stinks because I feel like I shouldn't have to talk to my doctor about how I'm going to take the baby for a walk. Like, Yeah.
Yeah. Well, and I agree with you. I'm kind of like that too. I think like 15 years ago, I was like, I'm an ambassador for the blind and I must always be in education mode. And, anybody that stopped me, no matter my mood, I'd be like, all right, we gotta go into the spiel. And, now I'm kind of like, yeah, this is not happening today, buddy. But yeah, when it comes to something like this, it is a little different and you ultimately have to handle it the way you're most comfortable with. But it's, and, I will say there's a way that a question's asked, even if, we might perceive it as being a little ableist or insensitive. But if I can tell the intent is more like they just want to learn, it's not so much like a questioning thing, if that makes sense. I don't know, I'm probably going to be more receptive as well myself, but yeah, it is hard. It's a hard balance to strike because I don't think that we have to always be ambassadors for the entire world. I don't think that, every encounter that we have to be that, professor of blindness. But yeah, certainly, in a situation such as this, dealing with, a doctor who you are seeing because you are wanting to have a child or you are pregnant, it is a very different situation. And so I think you just kind of have to be, I don't know, just really do what makes you comfortable. And ultimately, that's really what it's about. If you're comfortable, then great. But if you're not, you really need to consider that. And maybe you do need to find, a new care.
Yeah, it's really personal, like what you are comfortable with and what you're not. And, I know I always appreciate doctors who just kind of treat me for what I'm there for and, leave it be.
Well, but it's interesting because when it goes the opposite, it kind of like takes you aback. Because like a couple of weeks ago, I had to go to the ER. Like everything's fine, I'm fine. But, and this is the first time I've gone to this hospital because for the fans out there, I am new to Iowa. But so, I'm having to find like new doctors and it's a whole thing. So anyway, I had to go into the ER and it's like later at night and I'm just like, ugh, I obviously have to go on my own because of COVID. And so it's just like, you just prepare. You're so used to all those microaggressions that you're just kind of, you arm yourself for that. And I get there and like, everybody's lovely. I walk in, they're like, oh, just walk up to the reception desk. I'm like, okay, go over there, get checked in. I sit down, I wait, they get me back to the room. And like, they're just like, nobody's asking me about blindness. They're just having a conversation the way they would with anybody else. And at one point, I was like, I really need to use the restroom. Is that okay? And they're like, oh yeah. And then the nurse is like, okay, so just go out the door, take a left and then another left, and that's gonna be down the hall. I was like, oh, okay. Like I was kind of like preparing myself to be like strong-armed. So I think too, when it goes that way, it's refreshing, but it kind of takes you off guard as well. Cause I think we are, like you said, Stacy, so used to, a certain attitude with a lot of, medical people that's just kind of what we're used to. And so when it does go the other way, I know for me, it's like, this is lovely. So I actually gave them a good review.
I don't know if it's a Midwest thing, because I feel like the doctors in Nebraska and all the medical encounters I've had in Nebraska have on average been much better than those that I had in California. Now, when we switched providers in California, they got better. We hated UC Davis, but when we switched to Mercy, it got much better. But I will say, I don't think I've had a negative medical encounter in Nebraska yet, that I can think of.
Yeah, I'll say in Nebraska, when we were there, my
experience
was pretty great. When we lived here in Des Moines, when Ross and I were first together, this is 16, 17 years ago, I tried to find some doctors around here and it was awful. They were blind people can't. I mean, I was literally told blind people can't do this. And I'm like, what do you know about it? So
wait, in Des Moines? In Des Moines?
Yes.
What did they say?
Oh, I mean, it was most of it was in regards to my diabetes, but they were just so certain that a diabetic could not or a blind person could not independently manage their diabetes.
What? And, wow.
Yeah. No. Right. And by the way, I've been diabetic for 36 years, since I was 4 years old. So pretty much my whole life. So, and I haven't been blind that entire time, but it was just I've been dealing with this for long enough that I know what I'm doing, whether I can see or not, I know what I'm doing. And yeah, it was very frustrating. And so that's why I kind of been so reluctant. We've been here now for, I guess, about 5-6 months. Well, maybe not quite that long, but 4 or 5. But I'm dragging my feet about finding new doctors just because, and I know it was 16 years ago, but it was I had such a bad experience trying to find them here that now I'm ugh, I don't want to do this. Plus I've been seeing my doctors for 20 years. So,
and that's tough too, because like I said, I mean, in the one, it's oh my God, do you have to educate these people about how you manage your diabetes? But on the other hand, you don't want them to run into other newly blind diabetics and have them tell them, oh, you can't manage your diabetes independently. So it's tough because there's a part of you that's probably just oh God, let me just get out of here. I don't have the time for this in my life. But at the same point, newly blinded Bridget could walk in, and the doctors could need to know that, hey, there are talking glucometers or whatever. So it's,
there was one, this is just a funny little anecdote. So when we were living here before, several years ago, I had to be in the hospital for a short time. And so the nurse brought in my insulin to inject, and she was going to inject me. And I'm no, I can do it. And she kind of reluctantly hands me the syringe. So I inject myself, and then I go to cap the needle, and she freaks out. She goes, oh, stop. And, at first I'm well, what's going on? And she's you're going to poke yourself. And I just gave her this look, and I was and then as I'm staring at her, I proceeded to cap the needle. And I was I mean, okay, even if I had poked myself, it's a little syringe, it's not but anyway, but yeah, so that was kind of the sort of set, and that was just a small thing, but anyway, that's kind of a funny story. But
the thing, Bridget, is you and me are just old, curmudgeonly, cranky, blind women. We're 40 and we're already basically get off my lawn.
Pretty much.
Well,
I guess now we are going to give some very much unsolicited advice,
because that's what we do here.
Exactly. Well, so what is some unsolicited advice you have to give about thinking about being a blind parent, maybe if you have a genetic or hereditary condition?
Well, I mean, I would, I think we've kind of already said it, but I'll say it again. If you want to have a child, go have a child. I think that, I don't think you should be afraid of the hereditary condition that you may have. And I would just say, find healthcare professionals that are supportive and go for it. And if you want to know more, there are people who can help you to learn more if you are curious, but you certainly don't have to. So that's it.
Well, thank you so much, Ronit, for being here tonight with us.
Thanks for having me.
Yeah, we hope that, just really thank you for providing all that really good advice. I know that a lot of it will be new to some people, and I know it will be really helpful to everyone who hears it.
Yeah.
So.
Yeah, thank you so much. It was really great.
No, thanks for having me. It was great.